People across central Illinois have made the life-saving decision to lose weight, but reshaping your body often takes more than just that.
Yeah, whether we do it for cosmetic reasons or for better health, there's a new procedure people are trying that's showing dramatic results. And here with more insight on body contouring, Dr. Natasha Luckey for Carle. Sorry, I had a little dyslexia there, Dr. Luckey. So tell us a little bit about your background with body contouring and plastic surgery.
Sure. So I completed a 6-year residency in plastic surgery at the Southern Illinois University, and then I went on to complete a fellowship in plastic surgery, and specifically in cosmetic and breast reconstruction.
Interesting, and we're going to talk a little bit about how that all fits into this, but the idea of body contouring has really become something, especially here in the 21st century. So give people an idea, if they're not familiar, what body contouring is.
Body contouring is really excision of skin that may be loose or hanging after a weight loss, or liposuction or contouring of areas that are difficult to lose weight in.
So you get so you're talking about that flab that sometimes might be under the arm, or if you again get reduction here in the center, you might have an extra skin folder too. And it's the removal of those things.
Exactly.
Excellent. Okay.
So what areas of the body are most likely to get contoured?
So typically, patients I see will usually come in for abdominal issues, or back, hips, arms, even breasts fall into that category, and sometimes thighs.
Interesting. So if you get a breast reduction, you would have extra skin, or is this just for firming things up perhaps a little bit more cosmetic-wise?
So if you've lost weight after a breast reduction, you can have extra skin in that location.
Okay.
So what do you need to accomplish before coming in for this consultation, I guess?
So patients who are in general good health are good candidates for this type of surgery. Their BMI has to be less than 35. This is not a weight loss method. This is for patients who have already lost the weight, who just need a little help firming those areas up, getting rid of the skin. Patients who may have had issues with infections in those areas because of the folds of skin. These are patients that are good candidates, and overall they have to be in general good health for them to be considered as good surgical candidates.
And they have to take some tests before that, right? You guys are going to monitor that and make sure.
So their weight has to be stable for about a year, and typically in that year they go through kind of a nutritional deficit. And so with the help of their primary doctor, usually we monitor their labs and make sure that they're good candidates for surgery prior to that.
And what kind of results are you seeing? How happy are the people after having this procedure done?
So patients are thrilled. Really, it's the pot of gold at the end of the rainbow for them, because they've worked hard. They've really strived to lose all this weight. They've put forth a valiant effort to really lose the weight with physical activity, with diet, and some with surgery. So, you know, this is kind of their reward for doing all that hard work.
Talk, if you will, a little bit about what you hear from patients who come in, because I know that we're going to have viewers that this is kind of going through their mind. They're like, oh, well, I have lost a lot of weight, and maybe I could get some of this taken care of. But what kinds of things do you hear from people?
Typically, patients just want to either feel comfortable in their skin, or they want to deal with those issues of extra skin not hanging, precluding them from doing physical activity or being physically fit, or sometimes even they just don't want to have to deal with the infections, the skin infections that they keep getting.
As a result of having that excess skin. Interesting. I'd never thought about that.
And usually when you think of like plastic surgery or cosmetic procedures, you usually think of those as being like kind of elective surgeries, maybe not covered by insurance. Does insurance cover body contouring?
Yes, and to actually get details and to see which patients are candidates and what insurance companies cover, patients really need to schedule a consultation, because that's where the physician's going to be able to assess those patients and really determine whether it's something that insurance would cover.
And what kind of recovery time are we looking at after a surgery like this?
So it depends on the type of surgery and what you combine with it, but typically I tell patients about 4 to 6 weeks.
What do you combine? What kind of other things do they add?
So depending on what type of surgery they go ahead and proceed and decide to have, whether it's abdominoplasty, they may decide, well, I'd really like to do my breasts at the same time, or, you know, my arm skin, it's really bothering me. I think I would like to get that done at the same time. So sometimes patients will add up procedures and combine them so that they can get them done at the same time.
So you would do them all at once. You wouldn't like do it in phases, like, oh, let's do this area this time, recover, then let's do this area, recover. You just get it all done.
Sometimes.
And just like any medical thing, you're consulting with your doctor and the experts, and you're figuring out what's going to work for you as a patient. Yeah.
Right,
Dr. Natasha
interesting
Luckey,
stuff.
thank you so much.
Oh, thank
Interesting to
you.
hear about this stuff. Body contouring, it's a really exciting new thing that they're doing more of at Carle, and we'll connect you with Dr. Luckey online at carle.org. Our website's there, and we'll put that as well on CILiving.tv. Thanks for your time.
Well, one of this year's